Good morning, good afternoon, good evening. My name is Maurine Murenga. I'm the founder of Lean On Me Foundation and coordinator of TB Women Global. Today I want to talk to you about promoting a feminist, intersectional, and gender transformative approach to TB pandemic response. This is the project I was working with through the leadership journey through WomenLift Health. I chose this project because it's related to the kind of work I do, and that TB is still killing tens of thousands of Kenyans every year. And we wanted to look at what works, what doesn't work, what do we need to do differently. And so we decided to give it a gender lens through a feminist lens as well. And what we did was that we did a policy scan. We scanned the National Strategic Plan for TB to check on how strong it is on gender, especially in relation to women and girls. And we realized that it is gender blind. And then we did also an analysis of a report that was done, a gender assessment report that was done on Kenya. And I think this report was done on the background that men are disproportionately affected by TB and they get sick more than women. So the report missed an opportunity to give a recommendation or to identify the challenges that women face in accessing TB diagnosis and treatment due to cultural norms and the inequalities they face in the societies, the stigma associated with having TB as a woman, and the fact that some women are even incarcerated because they are diagnosed with TB. The report also missed an opportunity talk about integration of TB services with other reproductive, maternal, and child health services, among other challenges that women face. We managed to do an outreach. Actually, we had 2 workshops, one physically to disseminate these findings and to also forge a way forward. And another one was virtually to compare notes across 7 countries, that is Kenya, Uganda, Tanzania, Zambia, South Africa, Ukraine, India, and Indonesia. And so through what we came out with, some of the outcomes of the workshop was that we need to strengthen the leadership of women. Women, if we are given tools, if we are given resources and information we need, we'll address TB right from the household level. And this will be a game changer because we will be able to diagnose TB, to prevent TB and to ensure that we are not losing any lives because TB is curable. And we also know that where women lead, change happens. One of the challenges we are going to face in this process is that TB is highly medicalized, but we also have little resources allocated for the TB response. So bringing in a significant paradigm shift from the highly medicalized response into looking at social drivers is going to be a little bit challenging, but we will soldier on. We are determined. The leadership journey was quite interesting, starting with discovering myself, both from my own lens and from people around me. And initially, it was difficult to accept the report, but later, through the support of the mentors and the coaches, and also the learning and sharing platform with fellow colleagues, it was really easy to now focus on affirming my values and being very intentional with my leadership style. I was also able to attend webinars organized by WomenLift Health, and also reading some books that have been able to help me. I have strengthened my social connections, and I have also been able to trust and delegate more than I used to do before. And so I'm very confident about building a strong leadership, a strong network for change. I am communicating more clearly. I'm not assuming that people can read my mind, and therefore I know that people who work around me are able to identify that it's easy to now coordinate, it's easy to work together because of the clear communication channels. Moving forward, I think we will still keep influencing the policies and ensuring that eventually we will have a gender transformative TB response, a process that will lead us to accelerating the end of this epidemic in our lifetime. I'll keep mentoring young women and girls and also strengthening our partnerships. Together, we are strong. Thank you very much. Asanteni sana, erokamano, obrigado.